Our speakers are David Shelton. David, give everyone a hello.
Hey, good afternoon, everybody.
We're going to need to talk a little bit louder. David has been the Chief Operating Officer, David has been the Operations Vice President at MASH, Medical Advocacy Services for Healthcare, for 8 years prior to joining PatientMatters. He has extensive national and international experience in medical manufacturing and distribution. His career also included a role as general manager for a large national service company, which included insurance industry experience as well. He holds a Bachelor of Business Administration degree from Texas Wesleyan University in Fort Worth. Welcome, David.
Thank you, Betsy.
We also have on a call Sharon Van Ness. She's been an operations manager for 17 years with MASH. She's an experienced advocate and has represented and assisted patients through the challenges of obtaining their benefits. Sharon is also experienced in representing patients through Social Security disability claims and has advocated on behalf of patients all the way to the hearings phase of the SSD and SSI claims process. She manages hospital operations at facilities from Maine to Florida. Welcome, Sharon.
Good afternoon, everyone.
Cindy Diaz has been an operations manager for 10 years, working with hospitals in Iowa, Nebraska, New Mexico, and other parts of Mid-America. She started her career as an advocate and brings expertise in all the available government programs which are available to patients. David, Sharon, Cindy, are you ready? Take it away.
You bet. We appreciate everybody joining us today. We want to talk for a few minutes about patient satisfaction surveys and those scores and what they represent for your hospital and how advocacy can help in contributing to those scores and the improvements in those scores. There's 8 areas that patients can grade or give an opinion about their hospital experience. And although none of those are directly related to advocacy, 2 are directly impacted by advocacy, and I bolded them here on this slide: responsiveness of hospital staff and discharge information. And on the responsiveness to the hospital staff, when advocacy is done right, patients cannot tell the difference between the hospital staff and the advocates that we provide at the hospital. And for discharge information, advocates can be working SSDI cases for 12 or even 18 months after discharge, depending on the patient, the backlog at the local government office. So there is a lot of communication taking place with your patients long after they've left the hospital and moved on to their experiences in life. And even though we certainly are not communicating medical details to patients, there's 3 points in the survey portion that covers communication. And we believe communication is one of the key factors in how we work with hospitals and with their patients to make sure that there's a successful relationship and the patients are properly taken care of. I'm sure everybody knows, if you're a hospital administrator, you know the impact patient satisfaction scores can have on your bottom line. In 2013, there were over 1,200 hospitals that received payment increases based on the surveys of patient satisfaction. And at the same time, more than 14 hospitals actually were paid less for their Medicare patients that they treated based on those same survey results. So the survey results and the patient feedback is paramount to the hospital getting paid all the money that is available to them through the various government distribution processes. So how can PatientMatters advocates help? Again, let me reintroduce Sharon Van Ness and Cindy to you. They're 2 of our operation leaders and have many years of frontline experience with our firm. So Sharon, let me ask you this. Over the years you've been working in advocacy, how have you seen the changes in the advocacy work that's taken place and how those changes might be impacting the scores and things that a hospital receives today?
Okay, David. Well, we all know that policies and regulations change from year to year, but the one thing that has not changed and remains the same is the importance of connecting with the patient. I found this quote: "It's all about building a connection with the patient. Connection builds trust." It seems to hit home for PatientMatters because we know patient satisfaction is an important key for hospitals, and I believe that starts with communication and building relationships with patients. this is the beginning step to our model. We are able to sit down with the patient, have the one-on-one time with them, and getting to know them on a personal level. We understand the stresses a patient and their families go through, so we try to ease that stress in going, in gaining their trust and having compassion and being empathetic towards their situation. We're being their advocate for government assistance or even lending options, or the advocate is there to provide support through any available option. We're helping them through every step. How we do this, David, is that we sit down with them at bedside. We complete a bedside screening, asking questions, gathering information, so that we can find the best solution for them.
And that's a good point, Sharon. Just to add on there a little bit, with the bedside screening, we're wanting to obtain any information that is necessary to determine an application that we need to submit for an agency or even for the hospital. And with these applications, when we determine there's a solution for them, we are completing them with them at bedside. We're not leaving the patient to stand alone through the process. We are also walking through the full application process with the agencies as experienced and knowledgeable advocates. Understanding the red tape behind all the agency policies and procedures is in turn helping relieve the stress off the patient and family. And then again, just keeping that open line of communication between the patient and the advocate and also the hospital, so that we're always on the same page as far as the solution that was found for their situation.
So, Cindy, let me ask you this. How do you work with your hospitals to provide a seamless look for the patients, where the patients cannot tell the difference between your staff and the hospital staff? How does that work for you in your facilities?
Well, Dave, that's a good question, and that I believe, and through the experience of working with PatientMatters these past 10 years, and working on the front line with advocates, and also preparing for this meeting today, I did a little bit of reading through some materials, and I found this bit of information from Permanente's journal that shows, that pretty much sums up the foundation for patient satisfaction. It really deals with what's motivating their desire, and it's stated on this screenshot here, showing that they have the need for compassion, the need to be heard, and the need to be recognized. And I personally believe also there should be a fourth, is the need to be understood and desire to be able to trust, especially during the high stress situations that they're in the hospital. And behind that, the backbone of it is being able to communicate with them to make them feel comfortable. We touched a little bit about the bedside screening, and there's some instances, in for example, in my facility in New Mexico, we have a high percentage of individuals that are non-English speaking. So my staff there is able to communicate with them in their own language, and they're bilingual. And aside from that, we do have other sources, such as our patient engagement center that houses individuals that are multilingual and are able to speak with patients and also help out with communication in a written form as well. And I believe also by being responsive to our patients' phone calls and emails, their office visits to our location, being able to communicate with them in a promptly manner makes them feel that they are an important component to our organization, and they are. So they feel that they are not being left behind or left alone. We also work with the individuals with the agencies, the Medicaid office and Social Security, so we're helping to relay the information in reference to their appointments, making sure the patients are on time, that they're able to provide whatever the agency is lacking to process their applications. And it works on both ends too, David, because as far as the communication with the patients, we're also keeping that line of communication with the hospital open, whether it's with the hospital staff, financial counselors, care managers, whoever may be involved in our daily contact with us. We're keeping that communication open, and in fact, in two of my facilities, one in New Mexico particularly and one in Nebraska, I have two employees that were recognized as employees of the month. That shows quite a bit of dedication and commitment, and it also shows that the advocates are not only a good resource for the patient, but also a strong partner for the hospital. The hospital staff relies on us quite heavily for updates and communication on applications. And for another example, one of my facilities in Iowa, the social workers play a big part in our environment, in our world, and They rely on us for heavy communication on what's going on with applications, whether it's through a governmental assistance or other lending sources. They're looking for that solution to help the patient get them to the next level of their care.
That's true, Cindy. In my West Virginia and Maine hospitals, we also participate with the care management, weekly care management meetings and the discharge planning meetings so that we keep the hospitals updated on where we are on every case, wherever we're at every step. We want to make sure that when we meet with them weekly, we're prepared, especially on those higher dollar cases, that, we know that's very important to hospitals to see where those are at, and so we're able to communicate that with our weekly meetings with them.
Sharon, also, let me ask you this. You've got a staff that you work with that go through a lot of different training and things like that. Can you kind of touch on that a little bit as well?
Yes. If you'll go to the next slide, there you go. I wanted to put in this slide about, this is some of our employees, some of our highly skilled employees. Dorothy Alvarez is the one on the top left, and she's been with the company, just to give you a little history, she's been with Patient Matters for over 17 years. And then to the far right, you have Christina Tovar. She's been here over 8 years. And then at the bottom right is Christine Wynn. She's been here over 18 years. And then there's Scott Cunningham on the left, and he's been here 8 years. And Scott is also one of our certified hearing specialists, where when we have a disability case and it happens to get to that level after they've been denied recon and then hearing, Scott is just one of our Patient Matters representatives that will represent them in front of the federal administrative law judge, representing them at no charge to the patient. So these are very highly skilled, very helpful, compassionate employees. We do continuing education. We go to Social Security for training, Medicaid. I mean, we're very involved in continuing education just within our company's training program to keep these advocates updated on all the most current policies, procedures, ongoing webinars, various types of training programs to keep us updated on everything we need to do to make sure that we're top of the line for these hospitals that we're partnered with.
Another area that we find that directly participates in that patient satisfaction is a good patient satisfaction improves hospital census. And we found this quote, as consumer out-of-pocket costs continue to rise, they are also more likely to comparison shop and choose healthcare providers based on reviews. And one of the experiences that I think both of you have had in working with your patients is when we do our job as advocates and work well with the patient, communicate with them, help them through their particular issues, whether it's through a government program, connecting with a no-interest loan, all the different avenues are available, we find that those patients end up referring family and friends back to the hospital. And so, Cindy, let me ask you this. When you're dealing with the patients and whatnot, what are the results you get from those patients and the work that you've done with them? What are you hearing back from them on the work that your group is providing at the hospital?
Well, and you touched on a little bit about it, David. We do have quite a bit of patients that do frequently come back to the facility. Many of them do stay in touch with our advocates beyond discharge. Many of them will make a referral, word of mouth. We do have individuals sometimes call in and say, Sharon, you assisted Mr. Smith last month on an application. He told me about you, and he wanted me to come and talk to you. Are you able to help me? So we are getting patients getting that word of mouth out, and it may not just be from family, it may be from friends. And then also there's hospital staff that are very familiar with what we do for their facility, and also they also recommend members of their family over to us for knowledge and direction on where to go as far as assistance.
Sharon, do you have anything that you would add to that?
Just our building the rapport with the hospital and the family members of the patients and the patients as well, that's how they come back and they tell people what great treatment they've had at the hospital, as well as being helped with Patient Matters to walk through the process. So it is, like Cindy said, word of mouth and getting it out there, and that's why they want to go back to your hospital.
Right. thank you both. So we've been pretty brief today, but we'd say this just in taking a look and adding things up. Advocates improve your patient satisfaction scores at your hospital. A positive interaction experience with the patient, both in telephone and written communication. When we're prepared to be able to talk to the patients in a language that they're most comfortable with, we get better response from the patient. We're able to help the patient more thoroughly, and the patient is more comfortable throughout the entire process. Assisting patients with agency interactions. We don't just hand the patient an application and say, hey, let us know how things work out for you. We make sure that the patient doesn't go through that process alone. We participate through the entire application process, regardless of the number of months that can take, especially in difficult disability cases, working with the agency, the hospital, and the patient to bring a successful outcome. We establish long-term relationships with patients. The patients know who our employees are because our employees are long-term employees with us. We provide employees that have been with their companies for a long time, been through training, have experience, and are able to work with those patients on an ongoing pace throughout the relationship. The bottom line is we help increase the hospital census. Patients return to the hospital because they're pleased with the service that not only you, the hospital, provide, but that we provide from an advocacy component. And because we've worked with your facility, coordinated with your financial counselors and the different departments in your hospital, we're able to represent ourselves as a seamless transaction with the patient, so the patient never knows when they're talking to an advocate, talking to someone at the hospital, and ends up with a positive result at the end.